Good afternoon. Nurse Allen coming to you today from East Point, Michigan, today to go over how to take the Medication Aid Training Program test. Most people will be taking the knowledge test online at either a facility or in the comfort of your home or library, but you have to have two pieces of equipment to take the test. So you'll either have to have your phone and your computer so that the test proctor can watch you online, or you'll be at a state testing facility where you can take your state exam. Now, once you've taken your state approved program, and they're all at a community college or a university or a rehab center that has an affiliation with the college. Now, once you've taken that state approved program, then you're able to sit and test for your knowledge and skills test to get certified to be a medication aid. One of the requirements is that you have to be a CNA first, and then you take the class to become a medication aid. Now, once you've already you've already taken your exam, you've taken the test, you now are able to sit for the test. You'll have to pay the state of Michigan, TMU, $175 for the test. And then I believe the license is $165, if I'm not mistaken, every 2 years thereafter. And you still have to do all of your continuing educations to keep your state certification. Now, once you're sitting for that exam, you only have 25 minutes to complete two tasks that the test proctor will give you in scenario forms to pass medications for that particular patient. They're going to give you the scenario, but most of the time the places are not set up like PCC. So if you did a EMR system or point click care, it is not the same system that you'll be using to take your state exam. You will be using a system that's a computer system that the state has in place, and that you will have to go in. You're going to log into TMU. Your test proctor will at that time give you a start code. She will then read you the scenario, and you have 25 minutes to complete the task. So what she'll be telling you is that you have medication. So you may have a patient, it may be a mannequin, or it may be a live person sitting in a wheelchair. They're going to give a scenario, and then you have to execute from that particular time. So at that time, before they started, they went over the cart, told you where everything is at. So you already should know how everything is set up and what you should do at that particular time. Now, once you have identified the patient, they may say, for instance, you're going to be given Kenalog cream and digoxin. So you should find that patient's name. So she's going to give you a name. So she may say Thomas Jones. So once she gives you the name of that particular patient, you should be starting to look up your medication. So you should already know where the medications are in the cart, because she's already went over where everything is in that particular cart. Once she went over all the medications with you, at that time, your first check is when you see the person's name. Okay, she told you the name, Tom Jones. So now that you know you're looking for medications for Tom Jones, at that time she's going to tell you what time it is. So you're going to be looking for those medications. So if they're 9 a.m. medications, you should already start looking for 9 a.m. medications. Once you identify the 9 a.m. medications, at that time you should know what route you're going to be getting. So when you're looking at those medications, you should know if it's a drop, if it's a nasal spray, if it's a topical treatment. You're going to look at all of that on the MAR. So once you look at that on the MAR, it kind of relieves your anxiety. Okay, I'm not looking for a blister pack. I should be looking for a medication that's in a tube or some kind of bottle that I can instill drops or nasal spray or some type of ointment. You're not looking for a blister pack. So that's the first thing. So the key is, if I know how my medications are given, I'm already knowing that I'm not looking for a blister pack. So after you locate your medications, you're going to pull all your medications, the medications that you're going to be pulling, which is, we're saying in this sample, a 9 a.m. medication. So once you pull all your 9 a.m. medications, you're going to put them up against your MAR. And the MAR is going to look something, I want to give you the colored one. it's going to look something like this. It's going to be a colored MAR, and this is the difference because this is what the paper MAR look like. So you're going to identify your date. So whatever day that you're taking that test. So let's say today is the 27th. You're taking the test on the 27th. At that time, you should be looking for the 27th. Once you identify that you're on the 27th, you're going to scroll up to the top of that MAR. You're going to scroll up to the top of the MAR, and on the top of the MAR, I'm going to end up putting this on paper, but you're going to go to the top of the MAR, and the MAR is going to read at the top, in the top left corner, it's going to say order, label, and medication sheet. You're going to click on the medication sheet, and then you're going to scroll down to the MAR, and you're going to open up the MAR that I just showed you. So you're going to scroll down to that MAR because it's going to be a blank sheet. When you first go on there, it's going to be a blank sheet. You're going to go to the MAR, and you're going to scroll back up, and you're going to hit med sheet. It's going to open up the MAR, and that's where you're going to see where the patient's medications are, where the times for that particular medication are. Once you find out where the medications are, that's when you start your checks. So your first check is when you're already on the right patient. Okay, you know Mr. Tom Jones, this is who we're going to give medication to. So once you find your patient, you're going to review that medication. The first pull is when you review your first patient. Is your first check is when you identify who the patient is you're giving medication to. Your second check is when you pour those medications. So when you pour that medication, you should be putting it up against the MAR, making sure that you're giving the right medication to the right person. That's your second check. So all the medications that you're giving at 9 a.m., that's what you'll be pulling, and you're going to turn them over and start. That's your second check. Your third check is before you pop that medication, you're going to make sure, again, against the MAR. Is this Mr. Tom Jones? Date of birth, everything should line up. You pop your first medication. Put that medication down. Now, depending on if that medication is a cream or elixir or however that medication is to be administered, you're going to have you're going to do your hand hygiene. So at that time, you'll be done your hand hygiene. Then you start popping your medications. So you'll get your barrier. So whatever your barrier, so if you have a paper plate type barrier, you're going to put that barrier down, and you're going to start sitting your medications on that particular barrier. So once you identified that medication, you're going to put it to the side again. So that is your second check. Your third check is when you're putting it in the cup. You popped your medications out of the blister packs or out of the tabs or whatever, out of the cup, medicine bottles. You're going to put them up. That's your third check. Your fourth check is before you put the medications back into the medication cart. So once you put that in the medication cart, that is your fourth check before you went into the patient's room. The fifth check is when you get to your patient's room. You're going to knock on the door, identify yourself, explain what you're coming to do. You're going to let the patient know that you're there to give them medication. At that time, you're going to look at their wristband. I know in PCC you're looking at pictures, but when you're testing, you're going to still look at that person. You're not using PCC. You're not using any EMR system, so you're going to be looking at the patient's ID band. Their ID band should match the medications in what you looked and pulled from that medication cart. That's your fifth check. Now at that time, the patient may be sitting up in a wheelchair or lying in bed. You'll have them sitting up, and you will give them a sip of water first. So the first thing you're going to do is give them a sip of water and ask them, do they need assistance with taking their medications? Once you give them that sip of water, then you'll tell them what they're taking. Or you're taking lisinopril. You'll give them their medication. Now let me backtrack a little bit. When you're reading your MAR, you want to look to make sure that any of those medications that you're given does not have any parameters. Certain medications have parameters that say hold if their blood pressure is below a certain threshold, or hold if their pulse is below a certain threshold. So certain medications that you'll be given will have a threshold on there, and you want to make sure before you even pull to take that medication out the cart, you want to make sure that you've already checked that patient's vital signs. So before you pull that medication, you won't have to pull it if it's over or below that. So let's say you have a medication that is below 60, but for testing purposes, they want to kind of keep it in the right parameter that you're giving those medications. There won't be any holes on those medications. Most of the time you'll be within the parameters, but that's for testing purposes. Now, but for the most part, you want to take the pulse before you go into the patient's room, so that you already have all of that done, because you only have, I'd say 8 to 9 minutes between each patient. That's what I would give you to give that medication. Now, once you've identified and you went in the room and you gave that patient privacy, you've given the patient those medications, the right route, the right dose, the right time, the right medication. After you've given the patient, you've done everything you were supposed to do with that medication, you're going to tell the patient thank you and have a nice day. Do you need anything? You're going to give that patient their call light, open up their privacy curtain, and then you're going to go directly back to your medication cart and document. So it's a couple things, because I keep talking ahead of myself. Once you've pulled all your medications, so let me backtrack again. Hopefully it's not confusing. After you pulled all your medications and you've done your 4th check, so we're at the 4th check first. After you've done your 4th check, the next thing you're going to do is lock the cart. You're going to lock your cart, close your MAR, put the keys in your pocket, and then that's when you're going to go give your medications, and then you're going to come back to your to your cart. After you come back to the cart, you're going to unlock the cart to get the keys back, because a lot of people walk away with the keys to the cart. You're going to unlock your cart, and then you're going to document. So you're going to document all of your meds. If you have to throw anything in the garbage, at that time you'll be discarding them at on the side of your med cart. You'll be putting everything in the trash. Then you're going to go to the MAR to start to document your medications. So once you get to documenting your medication, the first thing you're going to go back up to is your medication sheet. Then at that time, you're going to go to the second part of it, which will be the text portion. So you're going to go to your MAR, and then you're going to go to text. Once you go to text, that is when you're going to input all of your medications. I have my little notes here to kind of keep me on task on what we're doing. So once you go to the text, you're going to go to the text part of your on the MAR, and then you're going to start initialing the medications that you gave at that particular time. So if they were 9 a.m. medications, you will be giving Mr. Tom Jones his 9 a.m. medications. You'll be doing your check again to make sure, did I give Mr. Johnson his medications? At that time, you'll put your initials there on that 9 a.m. medication. Then you'll go to your next medication that you had to give, and then you would document on that medication. There's a 4th line that you would do on that medication sheet. At the bottom is where you're going to click, and you're going to document that you gave those meds, and it says meds given in a day program. They have legends on there, but you're going to document if you gave those medications. It's going to be the final 4th box that you're going to document on. The first box is going to be for your initials. The next box is going to be for your full name. So you'll put your first and last name. You're going to make 2 boxes. Now, mind you, I didn't add that because the system, you have to click and drag to make sure that you're in the correct line. So you want to make sure everything is lining up properly so that you get credit, because I've had somebody come and they came and they put it on the wrong line. They were on 9 a.m. medication, but they weren't on the right line, so they didn't get credit for it. So you want to make sure everything is lined up. Once you line everything up, you're going to scroll back up to the top, and you're going to hit the review button. The review button is going to show you where your documentation is lined up at. And then if everything is lined up properly, you'll scroll back down to review all your medication, everything you initialed. Is it on the right date? Is it on the right time? Is it on the right patient? So everything will be there. And after you say, yes, I've done all of that, let's say you made a mistake. At that time, you're going to go to make changes. It's on right next to the review button. There's going to be a button that says make changes, and then if you have to make changes, that's where you would do so. After you make those corrections and changes, then you're going to go back to the review button again and review it to make sure everything that you put in there is correct. Now, once you hit that correct, everything is reviewed and is correct, you're going to go to the top. There's going to be a button. It's going to turn red and it's going to say submit button. Once you go to that submit button, you're going to submit, but don't hit the submit button if you have not checked everything to make sure everything is just the way you want it. Now, once you hit that submit button, that means that you've done everything. You can't go back and make any corrections. So I tell everybody, please do not hit that submit button until you're 100% sure that you've done everything that you are looking to do, making sure your medications are documented properly. Okay, once you go to that, then you're going to go to the next button and you're going to repeat the same process over again. I'm going to be bringing videos probably starting next week. I'm going to go over the videos and I'm going to try to have them on the computer where you can see it, but it's just on the practice test, they do have it where you're going to show it and you have to click and drag. It's not like PCC. You're going to be clicking and dragging it. Please click like, subscribe, and share. I will be bringing videos how to give those medications to make sure that you're doing it timely, because again, you only have 25 minutes and people run out of time all the time on giving those medications. I'm trying to bring light to make sure that you understand how to document your medications, what the expectations are, how to do it. And we're going to be going over, and I'm going to get better and better with the videos, so don't worry, you're going to see them and it's going to be done properly. I may not do it on a live person, it may be on the mannequin, but that's okay. You're going to have that ingrained in your mind how to do that, and then eventually I'll be doing the pitch. I'll be making sure you have videos on how to take the knowledge test, because my understanding that a lot of people are taking a knowledge test in certain things that they're learning in class. It's not on the test. We'll be going over that step by step on how to be successful on passing that test as well. Thank you and have a nice day. I will be coming to you regularly with videos just to make sure that you be successful with the test the first time. So thank you for looking, and I will talk to you soon. Take care.